Stroke. A stroke is also known as a cerebrovascular accident. The cause of a CVA is lack of oxygen to the brain. There are two types of stroke. The most common is caused by a blood clot blocking a vessel supplying part of the brain. The other is caused if a blood vessel in the brain ruptures, resulting in the area of the brain being squashed by the pressure of the blood. In either type of stroke, the signs and symptoms are very similar, and an area of the brain could potentially die. A stroke can happen to any person at any age. Signs and symptoms might include difficulty speaking. Can the person speak clearly and understand what you say? Weakness down one side of the body. Can the person smile? Has their mouth or eye drooped? Confusion. Unequal pupils. The casualty could potentially lose control of their bladder and bowel. The Stroke Foundation, together with the Victorian Government, have come up with an easy to remember action plan for stroke. It's known as FAST. Face. Check their face. Has their mouth drooped or their eye drooped? Arms. Can they lift both of their arms equally? Speech. Is their speech slurred? Do you understand what they're saying? And time. Time is critical. If you see any of these signs and symptoms, call 000 immediately. The faster the casualty gets to hospital, the better chance of recovery. So call 000 immediately. You're going to maintain airway and breathing. Call for an ambulance. Don't ask the casualty too many questions because their slurred speech may become distressing. Loosen any tight clothing. Place an unconscious casualty or a semi-conscious casualty in the recovery position and help to wipe away any saliva. Lay a conscious casualty down with their head and shoulders raised. And reassure the casualty. Don't assume that they don't understand. Signs and symptoms of a heart attack. Now, it should be remembered that every heart attack is different. Only a few of the signs and symptoms may be present. Indeed, up to a quarter of heart attacks suffered are silent, without any chest pain at all. Women may also have non-typical signs and symptoms, like nausea and vomiting. So, if you're in doubt at all, call for an ambulance. Here are some signs and symptoms to look out for. Central chest pain. Pain may radiate to the neck, jaw, and underside of the arm. Shortness of breath. Pale, sweaty, anxious, agitated. When you're looking at the signs and symptoms of a heart attack, next to an angina attack, they're very similar. An angina attack is where there is a partial blockage of a coronary artery. Generally speaking though, with an angina attack, with rest, it tends to dissipate and stop, whereas a heart attack does not go away. So angina is a condition usually caused by a buildup of the cholesterol plaque on the inner lining of the coronary artery. Cholesterol is a fatty chemical which is part of the outer lining of the cells in the body. A cholesterol plaque is a hard, thick substance caused by deposits of cholesterol on the artery wall. Over time, the buildup of the plaque causes a narrowing and hardening of the artery. Angina attack may occur during exercise or excitement. When you exercise and have excitement, the heart requires more oxygen, but the narrowed coronary artery cannot increase the blood supply to meet this demand. As a result, an area of the heart will suffer from a lack of oxygen. The casualty may feel pain in the chest, amongst other symptoms as a result. Typically, an angina attack occurs with exertion and subsides with rest. If the narrowing of the artery reaches a critical level, angina at rest, called unstable angina, may result. A casualty with angina, especially unstable angina, is at high risk of suffering a heart attack in the near future. When you're treating somebody who may be having a heart attack, always make sure you start with doctor's ABCD. Call 000 for an ambulance. Encourage the casualty to rest. Help them to sit or lie down in a comfortable position. Loosen any tight clothing, particularly around the neck and around the waist. Allow the casualty to take any heart medication that they may have. Reassure the casualty and remove any causes of stress or anxiety if it's at all possible. Monitor for signs of life. If you suspect a heart attack, check the casualty is not allergic to aspirin and is older than 16 and not already taking an anticoagulant medication. If this is the case, allow them to chew an aspirin tablet slowly. This may be beneficial. If you're unsure, however, wait for the ambulance crew to arrive. So the Heart Foundation came up with a publication to help people to recognize and get help for a heart attack. So if you feel any pain, pressure, heaviness or tightness in the chest, neck, jaw, arms, back or shoulders, you may also feel nauseous, cold and sweaty, dizzy or short of breath, you need to stop and rest immediately. Talk. It's important that you tell somebody how you feel. Then, if your symptoms are getting worse, then you need to call 000 for an ambulance.